viewers, my name is Dr. Julia. I come to you from Smiles Nutrition and Wellness Center. This is a functional nutrition practice that seeks to address root causes of illness. When we address root causes of illness, we are able to prevent new chronic illnesses, reverse or cure pre-existing chronic illnesses, manage your body weight, reduce susceptibility to infections, and delay premature aging. Today, I want to talk to you about the ABCs of a wellness checkup. Welcome. We have our ABCs of a wellness checkup that will usually help us to conduct a checkup systematically and comprehensively. We have A stands for Anthropometrics, and these are physical measurements that describe your body. They include weight, body mass index or BMI, blood pressure or BP, pulse rate, fat mass percentage, muscle mass percentage, waist circumference, hip circumference. All these measurements have a bearing on health and disease. Then we have B for biological markers. These are lab tests of interest to us that help us to describe you internally. We choose them according to your age, your gender, your medical history, presently, in the past, and that of your family. Biological markers are very important because now we know chronic diseases, especially the lifestyle chronic diseases, take years and even decades to become clinically detectable. Usually, in most cases, before they do, there will be these changes happening gradually in our bodies. And usually, these can be detected in the lab. And so, when we look at biological markers, we know the normal ranges. When we see deviations, we are able to tell something is not right, and we are able to help you intervene before it's too late. For those who already have an illness, there are also suitable biological markers that will tell us their prognosis. Are they getting better? Are they getting worse? Are the interventions they're already on working for them or not? Even for us, in our wellness checkup, these markers will tell whether our interventions are working for you or not. And so usually, they are done regularly. We'll do them at a baseline when we start the journey, and probably check months later, years later, how they're doing. An ideal situation would be where they're coming back to normal gradually. And then we will know the wellness checkup has bore fruit. The information we deduct from biological markers is wide and varied. To us, as wellness practitioners, we are interested in your hormones. Hormones will vary according to health. Some of the hormones that are of interest to us in wellness include hormones such as insulin, your hunger and appetite hormones, your reproductive health hormones. And so, we can tell if you have an imbalance by looking at suitable indicators. The other things of interest to us are the presence or the absence of chronic inflammation. Anytime our diet is not right, or we have food allergies, or we are doing our food in the wrong proportions, or we are exposed to toxins in our food or the environment, usually they will irritate our bodies. And these irritations will cause changes in some of our constituents, such as the white blood cells. Lab tests can tell us if these changes have occurred and to what degree they have occurred. We also use biological markers to tell us if your protein, carbohydrate, and fat intake is adequate or not. We can also check micronutrients using lab tests. We are able to tell about your mineral intake, your vitamin intake. Is it adequate or not? Then we have C for clinical indicators. This is a detailed examination of your body from head to toe. We look at your hair, the consistency, the thickness, the color. We look at your skin. We look at your nails, your eyes, your mouth, your tongue, and so forth. We can draw quite a bit of information from these clinical indicators. This includes whether you're adequately taking carbohydrates, fats, and proteins or not. They'll tell us about your micronutrient intake. Are you taking minerals? Are you taking vitamins and phytonutrients in sufficient amounts or not? Clinical indicators will also help us explain some of your signs and symptoms. And so they are also used to tell about prognosis. When we detect changes that are not normal, and we then go ahead to give our interventions, later on we go back and check for them again and see, is there a reversal or not? Then we have D, that represents diet and lifestyle. Under diet, we'll usually administer a 1 to 7 day journal, depending on the amount of time you have. This journal will tell us about the quality of your food, the quantity of your food, the variety, the frequency of intake. It also helps us to tell about your preference, so that when we are doing a meal plan for you, we don't prescribe something that is totally out of your way. It will tell us about affordability and access to what you have or what we are likely to prescribe. Then we have lifestyle. Under lifestyle, we examine your sleep. Sleep has a bearing on health and disease. Sleep has a bearing on our hormone levels. We have changes of hormones according to when we sleep, how we sleep, when we wake up, and so forth. Then we have stress. Stress is now a well-established cause of chronic illness. We want to know about your stress levels, your social environment, both at work and home. We want to know about your ability to handle the stress in your life. Stress will usually increase the demand for nutrients in our body. And stress is not just psychological. There are other forms of stress, like those that we get from injury, we get from changes in our biology, like pregnancy. Toxins are a source of stress to our bodies. Allergies are a source of stress to our bodies. Intake of excess calories is a source of stress to our body. And so we want to look at how much stress you have in your body and how well you're handling it. Repetitive stress to the body injures the body internally and will usually herald chronic illness. Last but not least, we will interrogate your physical activity. We will want to know if you're sedentary, if you're physically active, is it in adequate amounts, or is it in excess? because that too has a bearing on health and disease. Once we have all this information, usually we will relate it to patterns of health and disease that are already established from our knowledge of nutrition and wellness. That helps us to make a diagnosis. We call it a nutritional cum wellness diagnosis. And that diagnosis informs our intervention. And so we want an intervention that is not just generic, but very, very specific and custom-made for you. Wellness checkups conducted regularly will usually give us patterns of health and disease of an individual. And so would encourage you to have these checkups regularly. Because if we are able to really exploit this information, we're able to help you prevent disease and save quite a lot of money in hospital bills, in surgeries, and so forth. I would encourage each one of us to start going for health checkups. In fact, make a point to see us for your wellness checkup. Thank you. Goodbye.